Hi, this is Jude from @Jude Reborn. Today, I'm here to help you make the right decision and select the right plastic surgeon for your facial plastic surgery. Based on personal experience, many women that I've spoken to, working with the doctor a bit and researching, also, of course, having been in the industry for 35 years, the beauty industry, I'm prepared to share with you the 10 perfect questions to ask during a consult and to elicit the right information so that you can make the perfect decision and you can end up with the plastic surgeon of your dreams, someone that you feel very good about and you have great confidence in. You need to be able to walk in, literally introduce yourself, and say to that doctor, "Hi, Dr. So-and-so, just so you know, I do have a list of questions that I'd like to discuss today. I hope that's okay with you." And he'll say, "Of course." And you'll take out your questions. You can make a list of what to provide and you'll be ready and let the conversation begin. So without further ado, let's get into it. Think of the consult as beginning when you're making the phone call to book the appointment. When you're speaking with the appointment booker, you have to start asking questions. Does he or she perform deep plane facelifts? That's the first thing you want to know. You don't want a smash facelift. And if you're not sure what the difference is, watch my video called Meet My Plastic Surgeon, where he discusses in one of the questions what the difference is. You definitely want a deep plane facelift if that's what you're interested in, if you're interested in a facelift. Once you determine that the plastic surgeon offers deep plane facelifts, your next two questions would be, are there options between general anesthesia and or sedation? And you want to know because in most cases, I can't speak for you, but I know for me and for many women I've spoken to, most women and men prefer to go under sedation and not general anesthesia. And if you're not sure about the reasons for that, watch, again, Meet My Plastic Surgeon, or you can also watch my Miracle Facelift Part 1, where I talk about that. The doctor that I utilize, Dr. Ozzie, Jean-Paul Ozzie, does perform them with sedation. If you're interested in general anesthesia, your next question would be, does the doctor have an in-house surgery center or is it a separate out-of-house surgery center? And if it's separate, where is it? If you find out that the plastic surgeon does offer sedation as an option, and if you prefer sedation, then you certainly want to ask, what type of sedation is it? Does this doctor's sedation involve an intravenous, where you're getting something put into your vein that's going to relax you? We usually call that twilight. Or is it where I'm being asked to take a pill, maybe a Valium, something like that? Then you'll have a lot of information and you can determine if you want to go forward and you want to book a consult with the plastic surgeon, especially if they're charging you for the consult. You want to make sure that this person is meeting sort of your basic requirements that you're looking for before you go into the consult. Now, many plastic surgeons do not charge you for consultations. And if there is a fee, that's even more reason to go in prepared and not to squander the time and the opportunity. Okay, let's get into question number 1 out of our 10 perfect questions for a plastic surgeon consultation. I know some things that I'm concerned about, but I'd like to take good use of your discerning eye, and I'd like you to tell me, doctor, what are the 3 parts of my face and throat area that you think are really contributing to me looking older? And then if you mention 3 things and they don't include my concerns, I will add on to them, but I'd like to hear your areas of concern first. If the plastic surgeon does mention your throat, then you need to ask one more question. How would you perform a throat lift? Would you be using liposuction to draw out the excess fat and tissue and realign, or would you be approaching it manually, just sort of using your hands? It's important to understand that different types of plastic surgeons tend to go for the different approaches. General cosmetic surgeons love liposuction. They're accustomed to it. They've been using it on other body parts, the torso, etc. And it's fast, it's convenient, it's efficient. But our facial plastic surgeons, sometimes they don't prefer that approach. They prefer using their hands, getting in there, sorting through what you have, kind of figuring it out when they're in there. You should do your research. You should determine what you're most comfortable with. I know what I'm most comfortable with, which is not liposuction. You should figure out if you have a preference, maybe you don't. Only one of my plastic surgeons suggested a temporal brow lift, and that was when I brought it up, and I ended up having it, and that was the plastic surgeon that I actually chose. And one of the reasons I chose him is once I brought it up, when I said, well, what if we looked at one more part of my face? How about my brows? And he agreed. And he was able to give me even better justification for having the temporal brow lift than I came in with. I knew that we were on the same page. Many of you have asked me if I had a fat transfer. I did not. My doctor does not offer fat transfers. So it is something that you want to flush out during the consult. I remember that I asked, it was one of my questions, some physicians think that the fat transfer is integral to that and others do not. And if they do or don't, it's important to understand where they think you need it, if they think you need it, why, and if they think you don't need it, then let them explain and give you the confidence and the reassurance that you're looking for, that you'll still get the results you want without the fat transfer. In other words, what can I get out of these surgical procedures that will be better or different than having Botox, than having fillers, or than having threads? Have them explain how and why they are different and why you wouldn't be able to duplicate the results if you were simply going to your medical spa and having done the procedures you've always done, if you've done them at all. Asking question number 5 is important. You have to manage your expectations. Some people go into a facelift or a throat lift with minimal sun damage and their skin's in great shape. Other people go in with extremely wrinkled skin, lots of sun damage, lots of spots. And those people might need other procedures such as laser treatments or peels to really get to the heart of what they're hoping to see. Even if you know that plastic surgery is only one part of the solution and that you're going to need a few other types of treatments to really get where you need to go, at least you know that and you can make an educated decision with all that information, and you'll come out of it with the right expectations. Question number 6 gets to the heart of what this particular doctor's expertise is and kind of what you can hang your hat on that's going to be really special and great about this doctor. Do you have any special ways of stitching? Do you have any special types of thread or stitches that you use? Is there anything else that you've developed that's proprietary that would make me feel like going to you would help me to have less scarring and to recover quicker and more efficiently? Dr. Ozzie answered and had a very impactful response to that question. He said, actually, I have developed and perfected some very special ways of stitching, and I have some special materials I use to stitch you up with where you aren't going to have very much scarring. You're going to be able to see people within a week or two. I flushed all of that out when I asked that one question. I wanted to make sure, even though I don't have a problem with scarring, I still wanted to ask the question to understand what they could offer me that was unique and different. You may be surprised that many plastic surgeons today do not use drains. I had facial plastic surgery, I had chest plastic surgery within a span of 8 months of each other, and neither of my plastic surgeons used drains. This is an issue that many women write me and they're surprised about. It's almost as much of a surprise to learn that drains are no longer involved as it is to learn that you can take a Valium and go to sleep and have a facelift. And of course, if they say no, you want to say, oh, why? And just understand their reasoning. But also, if they say yes, then it's important to learn, well, how long do I normally have to wear the drains? Am I going to have to stay overnight with nursing care because of the drains? Are they very uncomfortable? What is associated with having drains? So you, of course, want to know how long before I can see friends and family and look and feel pretty normal, not be embarrassed, not look like I'm beat up. Maybe in your case, how long before I can go back to work? But this is a very logical question to ask once you've been talking about the proprietary methods that they have developed that reduce scarring and help you recover more efficiently. That should lead into a discussion of recovery time. And while you're on that subject, you also want to ask, how many weeks will it be until I can walk again? Power walk, jog, go to the gym, lift weights, do the Stairmaster, do aerobic classes. It's really important for managing your expectations to have that idea of how long am I going to really kind of be a couch potato, and then when am I going to get back into my normal routine. Question number 9 is a great question and a very important question because it is going to give you a window into whether there's an expectation that you're going to have to spend more money down the road. You want to ask, how long can I expect the facelift or the procedures that I'm having to last? And do you want me to sign up for these Morpheus 8 microneedling treatments, these series of treatments in the first year, in year 1, and possibly every year thereafter, to maintain the results of the facial plastic surgery? I interviewed 4 plastic surgeons, and 3 of them wanted me to do that. The doctor I ended up going with and said, no, you don't need any of these extra treatments. I'm going to build a corset in your throat and in your jowl area, and that should last 10 to 15 years. So many plastic surgeons are encouraging it. Now, Morpheus 8 is a great treatment plan. You generally have 3 treatments, and it rebuilds collagen under the skin, and over time, it tightens the skin. So, of course, it's not a bad thing, it's a great thing. However, it's more money, more dinero. If that's a concern to you, then definitely ask the question. Question number 9. Question number 10 deals with prerequisites. You want to know if there are certain things that you need to do or certain people you need to get approval from before you proceed. If you're going to use general anesthesia to get this done, yes, you will have to go through some medical approvals, and those will involve blood being drawn, an EKG, probably a chest x-ray, a general exam. You'll be going to your doctor and you'll be following a form that they will give you, and you'll be getting all these things done. And if they pass, then you'll be approved. If you're not having general anesthesia and you're having a local anesthesia with the Valium or the Twilight, then you still want to ask about these things, because you just never know what that particular doctor's protocols. If you're overweight, ask if you need to lose weight before you schedule the procedure. Also, ask if you're a smoker, how many weeks in advance you need to stop smoking. Also, if you have some type of heart condition or you're under supervisory care of a different type of doctor, you should ask if you're going to need approval from that doctor. So do you need to go to your cardiologist or your primary care physician and get some type of approval? In most cases, the answer will be no if you're not going through general anesthesia, but you definitely want to ask so that you know and you don't have any unexpected requests put upon you. And those are our 10 perfect questions. But I'm not done yet. There are some questions to ask the surgery concierge or whoever, maybe it's the general nurse manager, whoever is going to be the one to talk to you about price. Do not ask the doctor about price. The doctors are uncomfortable discussing price. Okay, here are your questions for the surgery concierge. Do you accept Care Credit? Care Credit is a program that most plastic surgeons do carry. Care Credit issues their own credit card, and you can pay for your procedure on a monthly basis, interest-free, perhaps for a year, perhaps for 2 years. Doctors all have their own terms. So you want to ask in case this is something that you need to finance on your own. It opens up plastic surgery to so many more people that could not financially work it out otherwise. The next thing you want to ask about is, do you charge for your procedures a la carte, meaning every procedure that's listed has a separate price point, and you'll see that when you get the piece of paper in the folder from them? Or do you have a discount for bundling procedures? And what would those bundled procedures be? They may offer a discount for having the face and the throat done together. They may offer a discount for having an upper eyelid bleph or a lower bleph or both, with a temporal brow lift because it's all that part of the face. So you want to ask, is it a la carte or are there some bundling options? And then thirdly, you want to ask, do you have any incentives for paying in cash? And do you have any incentives for giving my permission for my before and afters to be utilized on the website? So good luck with your consults. I'm excited to hear how they go. I hope that you'll leave some comments and let me know if this helped and if this made a difference. And if you feel empowered and prepared when you walk in that room and you're eye to eye with that plastic surgeon, and if this did in the end help you pick the best plastic surgeon for you. So thank you again for visiting my channel. I hope if you got value out of this video, you will hit the subscribe button right now. And don't forget to like, and I'll see you on my next video. Take care. Ciao.